All right. Good afternoon, Sister Joubert. Thank you so much for joining us today on behalf of St. Helena Sandveld Hospice.
My pleasure.
Such a pleasure to have you here. So maybe you can start off by telling us a bit about your journey with St. Helena Sandveld Hospice and what makes your hospice and your community unique.
Okay. Our hospice is, our office, let's put it that way, our office is situated in Vredenburg. That's along the west coast, about 120 kilometers west of Cape Town. We have just now celebrated our 21st year anniversary. So we've been going for 21 years. We've started out small, and I won't say we've grown. I do think patient-wise, and but yeah, we're a lot less staff now than in the beginning, because then there was different services that was rendered. So the area where we work is, if we can take the map and go from Dwarskersbos to Hopefield, down to Langebaan, and then seawards. So that's the whole drainage area. So we are 4 registered palliative care nurses that works this area, and each one have a different town that we work in, so that the patients see the same face each and every time, and a relationship can be built that way. I think that is about it. Yeah.
All right. So you mentioned that you work along the West Coast.
That's correct.
So maybe you can just tell us some of the biggest challenges that the hospice faces in serving this area, and how do you overcome those challenges?
Well, we are the last hospice on the West Coast. So you've got St. Luke's Hospice and West Coast Hospice that does up to, I do think, Blouberg. And then actually the services, there's no services until we get to Langebaan area. So the Eiserfontein, Hopefield, Eiserfontein, Darling area, and also Atlantis is bare at this moment, if we can put it that way. And well, north, there's also nothing. Going inland, the towns of Malmesbury, Mariatsburg, and inwards does not have any hospice services. The only closest hospice is Paarl, that does that area, Paarl, Wellington area. We are, like I said, we are the only the hospice on the West Coast. We are also an NGO, so we have to generate our own income. Luckily, we are now registered with the Medical Council, and we are able to claim for our private patients. So that has helped us a lot. We also have 2 charity shops that we run, one in Langebaan and one in Vredenburg, 2 shops that you can't walk by if you come this way. We have really beautiful stuff there, and that also gives us a very sustainable income. At the moment, we also are so lucky to have 2 oncologists here in Vredenburg, and where they can also give chemotherapy is also administered here. So since they are here, we also, our referrals for private patient has increased quite a lot. So that makes it also stable for us. The challenge that we face is that we are restricted to our areas, and we can only offer telephonic support to patients that do not reside in our area.
Well, it sounds like you really are coming up with some good ways to kind of, overcome these challenges.
Yeah.
So that's awesome. So I guess it kind of leads on a little bit to my next question. I'm really interested to know how you feel that working with our remote or our virtual doctors as part of the Aligned program has influenced the way that hospice delivers care.
When we started connecting, or when the connection started with Align, at that stage we did not have an oncologist here. So it was just the local GPs the specialist that was in Cape Town, and then aligned with the virtual doctors at that stage. It was usually one doctor that supported the whole area, so that, yeah. And it was in the beginning, it was quite difficult to get used to it. It's not a case that you can go into the office and see the doctor within 5 minutes. So it is at times a problem, not because, like I say, the doctors are not always immediately available. Scripts also then needs time. The doctor has to send the script to the pharmacy whenever they're available to, and that sometimes mean that it needs to can only be get the next day. So it's not the doctors, it's the process that sometimes can be a problem. And also for the patients themselves, consulting with the doctor virtually, especially the elderly, was at times a bit unnerving, if I can put it that way. But I must say that the virtual partners, the virtual doctors, really is of a, I don't want to say of a high caliber, but their personality made it quite easy for the patients to adapt to virtual consultations. But with Align per se, it's always nice. Send a message, I need a hospital bed, and you sit back and everything is being arranged for you. So yeah, it was getting into moving forward with times and not staying stable with the old. Yeah, it's moving along.
That's wonderful, wonderful feedback. Very, very glad to hear that. So yeah, I think one of the things that we come across in this line of work is that there are so many misconceptions about what hospice does and what hospice means. So yeah, maybe you can tell me what you think are some of those biggest misconceptions, and what would you like the public to understand instead?
I think many patients do not want to be referred to hospice because they don't want to accept that their diagnosis can't be turned around. And then other fields that they clung to their religion, and that they feel that if hospice comes along and pop in, that their belief is not that strong. How can they ask hospice to come? That's when they need to believe that they will be healed. So I do think sometimes it's that the that getting hospice involved will be contradictory to their beliefs. And that's not only in the Christian faith, but also other faiths and beliefs as well. I also do think that sometimes people think if they see the hospice car in front of the house being parked, that you must sort of get the funeral people aligned as well, because it won't be very long. They don't understand that the concept that we walk the long road with you, even if it's a year or two's time. They think that if hospice is there, it's just a case of days or weeks. And then the later on, we also realized that a lot of people think that hospice does give 24-hour physical care, that we're there to do the physical caring, the washing, the cleaning, and that sort of thing. And as soon as we say, but unfortunately we don't have that service here, so what are you doing then? That they don't have insight into the bigger scale of things.
Oh, it's so true, so true. So I guess then that also kind of rolls into my final question for you, Sister Joubert. How do you see the role of hospices like yours evolving in the South African healthcare landscape? Because it does feel like palliative care is becoming more integrated into our healthcare systems?
For sure. DOH now has made palliative care, gave palliative care courses. There's palliative care sisters appointed at certain provincial hospitals as well. And I do know that palliative care is also included, even a basic thing, into the training of medical doctors as well. And that's a very good thing. We do feel that due to the increase in the population, the general elderly population older population that we do have now, and a lot of comorbidities due to lifestyle, the demand for palliative care will increase. Also, people are now much quicker diagnosed, so that the road that hospice can walk with patients, or palliative care can work with patients, can now be much longer and more sufficient, if I can put it that way. It's not a case of rush in to get everything ready. Yeah. The other problem that I do think that we have with palliative care, that it is not an attractive field like pediatric, or it's not a glamorous field. So I don't think it's a field that a lot of registered nurses would like to go in, because it is an emotional demanding field. It's a draining field, but also a very rewarding field. And so, yeah, it's not an attractive. I'm not quite sure how sustainable the training in the long term will be for hospices especially, that can't really compare salaries with private sectors, will be able to continue this. I do think, and I know of quite a few people that has done the palliative care training that has gone into private practices. And then, well, they're not restricted to one area, they can move around, and so the staff will then rather enter the private market. They can claim from the medical aids as well. So, but yeah, I do think that the other field that I also think that palliative care must sort of look at is the care of the elderly, because most of their diagnosis is also life limiting, if I can put it that way. That training in palliative care also goes into the geriatric care as well. But yeah, so I do think, yeah, the other thing is that if all areas can be covered by a hospice, and why we say a hospice is that at a hospice there's certain standards of care that is being given, whereas individuals can do I'm not saying they're giving below par service, not at all, but it's also always nice if you work within an organization where you can have support, where you can debrief and so forth, and where there's certain levels of care. So we would love all areas to be covered by a hospice, but due to the lack of financial support from Department of Health for state patients, this is unlikely. And yeah, we work a lot with private patients, but yeah, we must never forget the state patients as well.
Of course. You're such valuable insight, really, really. Yeah, it's been so incredible chatting with you. Thank you so much for your valuable time. I know you guys are so busy, but I just want to say a massive thank you on behalf of Aligned for the incredible work that you and the hospice team do. You are, yeah, such an asset, and we are so grateful to have you on our network. And we really do look forward to future collaborations with you.
Thank
So
you
yeah,
so
just
much.
thank you.
I think in the beginning, when a line came out, we thought, oh my word, how are we going to collaborate and how it's going to go? And then we did it, and we're so glad we did it. It made such a lot of things so much smoother for us, as for you as well, hopefully, and for the patients, because we're all there for the patients. It's a very rewarding work that we do. I always tell my patients, I'm so sorry I have to come and see you, but I'm so glad that I'm able to come and visit you. And I do learn such a lot from each and every patient of mine.
So special. Thank you. And thank you for that amazing feedback. Yeah.
And thanks to
Thank you
Elaine.
for your time.
And thanks to you too. Have a wonderful day.